once they see, and then I have to do their part. Keep the dues from. I get it. I mean, that's what they're doing. It's like, come on, that's really safe. I'm seriously serious. You know, they're actually forcing closures. And there's no solution. There's no, because we have perfect. You can't just ignore it. It's not possible. So I don't get it. What are you going to do? You got to do something with it. Not for nothing, but there's only so much that
Good morning, everyone, and welcome to this week's Member Connect AAMA webinar series on COVID-19 recovery. This week's edition is Reopening We've Begun. Your moderator is AAMA's Executive Vice President, Pete Gustafson. Go ahead, Pete, take it away.
Thanks, Tina. Welcome and thank you all for joining us for our 6th AAMA Member Connect webinar. This is in our series titled COVID-19 Road to Recovery. As Tina told you, I'm Pete Gustafson and I'll be your moderator today. Today's program will begin with an introduction of the panelists, followed by a series of questions we prepared for and supplied to them prior to today's webinar. The idea will be to quickly move to questions from you, the audience. You can pose your questions by typing them into the Q&A tab at the bottom of your screen. You may begin to do so now and throughout today's program. We'll do our best to get to as many as we can prior to the end of the webinar, but if we're unable to, we'll answer those in the recap email you'll be receiving after the webinar. There will be a series of poll and chat questions appearing during the presentation for you, the audience, to answer as well. The result of the polls will be posted during today's presentation, so please answer them as they appear so we can post results as quickly as possible. We're joined today by 4 remarkable panelists representing national location-based entertainment centers, family entertainment centers, and the medical research community. Let me introduce our panel. He's an innovative CEO with 30 years of experience developing new business models and turning them into success stories. He is a strong strategic thinker and team builder who enjoys turning problem companies into success stories. Before taking on his role as CEO of General Vending and Game Time, he built several amusement and entertainment companies, which he later sold to move on and meet new challenges. His rod operation, General Vending, has survived many economic challenges, including 9/11, and has always come out on top. In 2010, he acquired GameWorks in both Miami and Tampa and rebranded it Game Time. The choice to move into the FEC space has proved to be quite successful. Since then, he's built 4 new centers in Fort Myers, Ocoee, Daytona, and Kissimmee, Florida, and 2 more projects currently underwater in Clearwater and Plantation, Florida. He's going to take over the state. His message to us today is that historically, humans make their best decisions at their worst times and their worst decisions at their best times. I hope you take comfort in knowing all the challenges you overcome today will make for a much better tomorrow. I'd like to give a warm welcome to Mike Abecassis.
Hello, everybody. Thanks for the great introduction, Pete.
No worries, Mike. Moving on, he's been the Senior Vice President for Entertainment and Game Strategy at Dave & Buster's since November of 2012, and is perhaps best known as one of the original 4, a group of 4 individuals at Microsoft who came up with the idea for the Xbox video game system, an interactive that grew in part out of his role as Group Product Manager for the DirectX family at Windows Technologies. Prior to joining Dave & Buster's, he co-founded or held executive-level positions at a number of companies in the technology and video game industries, including Capital Entertainment Group, the video game industry's first independent production company, Nivelle Interactive, the largest independent game developer in Eastern Europe, and Bebo, one of the world's largest social networks. Over the years, I've had the pleasure of sitting in the audience for many of the thought-provoking keynote addresses he's delivered, and I found him to be one of the best public speakers this industry has. Please welcome Kevin Bachus. Morning, Kev.
Thanks, Pete. First of all, I have to apologize. I've been on vacation for the last 3 months. Is something going on?
We'll get you up to speed here in a minute, all right?
Okay, thank you. I appreciate it. I'm very confused right now.
He's been with Wild Island Coconut Bowl, the biggest little family entertainment center in Sparks, Nevada, since 1993. And he's been its general manager for the past 20 years. He's extremely active in several trade associations, including IAPA. He's the president-elect for the Northern California, Northern Nevada Bowling Proprietors of America Association and chairman of its education program. In addition, he volunteers as a member of the National BPAA Education and FEC Committee. He and his team were recently rewarded for their dedication to the industry by winning the 2019 AAMA FEC of the Year Award. Under his leadership and hands-on management, the Coconut Bowl has become more than any standard FEC. It's a place for its team and community to come together as a family. Welcome, Craig Buster.
Thanks, Pete. Appreciate it. Happy to be here.
And last but not least, he's an expert in antimicrobial resistance who presently serves as professor and department head of the Biochemistry and Molecular Biology Department at Oklahoma State University. Over the past 8 years, he's been tasked with improving the department's educational programs and aligning future research programs with the strategic objectives of the Division of Agricultural Sciences and Natural Resources. He previously held positions at New Mexico State University in Las Cruces, New Mexico, where he served 10 years on the faculty and 4 years in administrative positions, first as director of NMSU graduate programs in molecular biology, then at associate department head of biology, and finally as the biology department head. He also served 2 years on the faculty of Chicago College of Osteopathic Medicine. Since beginning his 24-year academic career at the School of Biomedical Science and Curtin University of Technology in Perth, Western Australia, he's been successful in securing millions of dollars in grant funding to support his research on microbiological resistance in bacterial pathogens, and recently in science education. And if that all sounds familiar, it should be, because he's backed by popular demand. I'm proud to introduce my younger brother, who read way more books than I have, Dr. John Gustafson. And I was remiss. One more member to join us this morning is Todd Manzil. Todd's with us, was sent from Cinergy Entertainment, who's a really unique enterprise. They've brought film, cinema, multi-screen cinemas into their space with food and beverage, a phenomenal FEC, chef-driven menus. They were winner, I think, of the 2018 FEC of the Year from IAPA, and he's the Vice President of Operations. Todd Manzil's with us today as well. So with all those folks in the house, these panelists have generously shared their vast knowledge and professional experience with all of us. So let's get started. Before we do, I'd like to remind the audience to send in your questions using the Q&A tab at the bottom of the screen. And John, I'm going to start with a question for you, if I may. It's my understanding that the DNA of the C19 virus has been completely mapped. And with that, it would seem we know the enemy. If this is the case, why is it going to take months and perhaps years to develop a vaccine?
I have a very long-winded answer to that, so bear with me. I'll try to make it as short as possible. Number one, it's not a DNA virus. It's an RNA virus, which makes it very different, which opposed to a double-stranded segment of nucleic acid or a genome, it's a single-stranded RNA virus. So there's a special technique that they utilize to actually identify it. First, they have to turn it into a DNA molecule, and then they're able to sequence it. So the fact that this thing has been completely sequenced, we know all the letters in its genome, so we can determine all the proteins that it produces that are involved with the infectious process. That helps us identify when it mutates. We're able to track its spread because now we've got signatures to follow it. And it also helps identify treatments and potential vaccines because what we do is we focus on individual proteins that the virus produces, okay, to either make vaccines or to develop small molecules that will inhibit the action of the other proteins involved with the replicative process of this virus. So those molecules won't hurt you. They'll only target the virus, kind of like a magic bullet. So that's why it's so important that we have that. We do know the enemy. I think this virus is going to be more well known than HIV in a very short time. And HIV is probably the most understood biological system out there. Now, with regards to vaccines, vaccines take a very long-winded process. Let me start by talking about the pharmaceutical industry. Everyone's crazy. Everyone needs to get an erection. You don't want to lose your hair, and my God, you're fat. And so they want to work on drugs that people take for their lifetime. Okay, so antibiotics, antivirals, things like that, while they'll do it, you know, especially now because there's a market for it, it's not something that they're really interested in. And vaccines are even more complicated than those drugs. And they do it for business models, you know, the billion-dollar pharmaceutical market out there. They want a $1 billion product to put out before they do it. And so, you know, so in their defense, they're a business, you know, for the most part. Vaccines are something more of a public health thing. And so initially you have this exploratory phase where you have this research intensive phase of the development process. First of all, they have to identify those viral proteins that your body recognizes and produces antibodies against. You know, so they have to identify natural or synthetic, what are referred to as antigens, or the things in vaccines that stimulate your immune response. Okay, and these things may help prevent a disease or treat a disease. And antigens can even include weakened strains of a particular virus. The live polio vaccine, I don't know if you guys know this, but polio, it might be eradicated from the face of the earth, similar to smallpox. It is no longer in the human population, and we eradicated that with vaccines. Incredibly important. And then you go into the preclinical phase. And during this phase, you know, researchers, usually in private industry, they use tissue culture or cell culture. And so these are human cells, or they might even be chicken eggs, and also animal testing to determine whether a particular vaccine can produce immunity. Okay, so that's the next step. And maybe some of these vaccines don't move on to the next step because you don't get an antibody response or you don't get an immune response. And that gets really complicated, that process. But let's focus on antibodies. Antibodies against a particular infectious agents protect you. Okay, so the next, you know, and then, you know, it also might, at that stage, the preclinical, it might prove harmful to test subjects. So vaccines are a godsend. They're a miracle that you just can't let go. My parents probably would have given their arm to prevent their kids from getting measles or rubella in their kids, because of the fact you would get an encephalitis or your brain would swell and then you would die. Those are the bad effects of those viruses. And so vaccines are just incredible. Then you go into clinical development, you know, and at this point, a sponsor, a private company, they submit an application for an investigational new drug, for instance, to the FDA. And this document, you know, summarizes findings to date and describes how the drug will be tested and created. You know, and the institution will then host clinical trials, you know, with large cohorts of people, which is important. And then once the proposal is approved, the vaccine must pass 3 trial stages of human testing. Phase 1, you administer the candidate vaccine to a small group, less than 100 people. Hey, nobody dies. Great. And it produces these antibodies. That's fantastic. Phase 2 can include hundreds of human test subjects, and it aims to deliver more information about safety, immunogenicity, the ability to stimulate the immune response, and then immunization schedule and dose. If you go to the CDC, they'll give you both children's schedules and adult schedule for vaccines. And I really encourage all of you to go and look at those schedules because they're incredibly important. And then you have phase 3, which can include thousands or tens of thousands of test subjects, and this continues to measure the safety. And then at this time, usually what you find for every single drug, antibiotics, aspirin, everything, they all have rare side effects, that sometimes don't appear in smaller groups because, you don't have the greater genetic diversity within the initial cohorts. And then you also want to look at the effectiveness of this candidate vaccine. And then, just to speed it up here, guys, then you've got regulatory review and approval. Then you've got manufacturing. I mean, the guys who initially discovered, the guy who discovered penicillin, which is not a vaccine, it's an antibiotic, which is given to treat bacterial infections. He was a sloppy microbiologist. And so he didn't use proper aseptic technique. And so when he discovered penicillium growing next to Staph aureus or golden staph and showing that the penicillium was killing its neighbor on this petri dish, okay, it was serendipity, okay? But then the guys who actually shared in the Nobel Prize, Chain and Duthie, they figured out how to grow penicillium and then extract clinical material to be used to treat patients. And so that takes a long time. Manufacturing is no easy process for a vaccine. And then, of course, you've got, quality control that takes, over after that. And
so there's a ton of steps involved.
Ton of steps. And I'm sorry, guys, but I just wanted you to know. And the reason why that scientists do that is to make sure before we do this, we produce the least amount of harm. But realize, guys, when I get ibuprofen in my laboratory, it's got a skull and crossbones on it. So you want to follow the manufacturer's prescribed doses of ibuprofen. When you take an Advil, take 1, don't take 2. Because you can have toxicities associated with these drugs that a lot of people don't know about.
Got it. Thank you, John. That's a lot of information there. Mike, moving on to our industry, what do you think is the greatest exposure FECs have to the reactivation of our businesses?
Well, actually, I'm going to jump back to your past question that John so eloquently answered, but took too long. The reason it's taking so long to get a vaccine is because the coin-op manufacturers aren't in charge of it or becoming the market. So,
Amen.
We certainly know how to get things done faster. I guess the process is a little bit more complex, but we get them out there, we test it. If the cash box is full, we make more of them. So hopefully we get back to that sooner than later. So there's 2 pieces I'll answer on that. I guess the first piece, the biggest concern that I look at on a regular basis right now as we try to bring things back to market is really that as an industry, we're going to be bulked together. FECs that are theaters and bowling centers and Dave and Buster's and main events and game times and all of the above. And I think as a whole, if somebody is found doing something outside somebody's comfort zone, social media can very quickly beat us all up, and I think we'll get grouped together. So I think the possibility where we change consumer behavior, where they start to associate that FECs are a place that aren't safe to go to, is probably the single greatest exposure that we have. I think it's important that as partners in this industry that we all, understand that we've really got to be good stewards of the industry and make sure that we're taking the steps that are needed. We're being overcautious. We're erring on the side of caution. We're doing all of those things because as things get found and as things get seen, the ability for them to spread is much more so like a virus today than it has been in the past. So I would say that because we're a small niche industry, the possibility that it's viewed as all as one is greater. So restaurants will be found to be unsafe. Maybe a server's not wearing a mask, or they shouldn't be wearing gloves, and a busser should be wearing gloves, and they're not. Well, that will be looked at as one particular brand or one particular segment of food service. But as FECs and as entertainment centers, I think we're going to get all bulked together. So I would just say that our greatest exposure is changing consumer behaviors where they don't believe it's safe to come to FECs anymore.
Got it. Todd, let me move to you real quick. You've actually had some opening in Texas, and you must have had expectations on how your guests would re-enter your space. How they would interact with your attractions, food and beverage service, games, etc. How close to your expectations have the actual results been, and have you experienced any surprises, and what were they?
Well, I think the biggest surprises we've had have been that the initial first guests that came in, they're the folks that are not afraid of anything, right?
Yeah.
I mean, so our expectation of setting the center up and being as safe as possible as we can and going through everything, they really couldn't care less at that point coming in. And so we battled with them, trying to show them how we still have to be safe.
Right.
It's slowly changed a little bit. Of course, we've opened in stages. Texas, and to Mike's point about everybody being in the same lot together, we are in the same lot together, but our state and local governments don't understand what we do at all, right? They have no clue as to really what we do in our buildings. You know, for example, bowling is open in Texas, but no other interactive attractions are. Well, bowling is an interactive attraction. No matter what you say, that's what it is, right? What's the difference between bowling and axe throwing? It's the exact same thing with one's got an axe, one's got a ball. And so the difficulty has been, you know, we opened theaters. We were able to open our movie theaters first at a 25% capacity. And we had food and beverage service at our concessions only. And then slowly we've rolled in other anticipated attractions. But we're doing what the state is allowing us to and doing even more. So to Mike's point, we're trying to be as safe as we can, even above and beyond what the state is allowing us to do. And I think that's key to how you need to open. So our expectations were that, you know, we would open safely. But what happened to us was we were at a battle with the guests coming in. They don't understand 25% capacity, right? What do I do when 50% people show up at my building? Tell them they can't come in, right? And so we had these battles going on in the buildings. And I think that's, as we open, operators are gonna have to understand they have two different kinds of guests coming in. One that don't care, the others that are very cautious. So you have to kind of curtail all of that together.
Yeah, it's a challenge, right? It's interesting, the comment you made about the initial guests coming in really are I'm not going to say oblivious, but they feel impervious to it's a whole lot of hot air and nonsense, and obviously that's probably not the correct attitude to have. But Kevin, let me move to you real quick. Can you give us a measure of the comfort level of your guests as they re-enter your space? I mean, these guys are starting to come in, and as Todd said, I'm guessing that the same case with you, that you're seeing folks coming in who really weren't concerned in the first place. But do you have any gauge on that?
Yeah, I mean, I think that what Todd said is exactly right. You know, the people that are coming back are the people that aren't particularly concerned. And so, you know, I think that we've seen a very, very similar kind of profile. You know, one of the things that I've been advocating internally is that although, you know, traffic counts are relatively low, and I guess that's an understatement, I look at it as an investment because we're learning a lot every day as we find out what happens. So, you know, we came in with certain theories about what we'd have to provide, and, you know, masks and gloves and sanitizer and all that sort of stuff. But there's nothing as valuable as getting, you know, the actual data, the observations. And so to the extent that you can, you know, help your teams to be your eyes and ears on the floor to report back and say, look, this is working well, this isn't working well. There are two things that have been really important from my standpoint. One is that in part because we want the guests to have a good experience, and in part because we have very, very, very low staffing levels, we want to reduce friction. We want to avoid a manager call. And so we've actually, you know, gone to a great extent to space out the games and do other things that we might not do otherwise, assuming that guests would, you know, behave themselves. Because you have a misbehaving guest, that means that your teams have to go out and address that issue. So to some extent right now, and I'm hoping that this changes over time, we're being a lot more aggressive about certain things than we might be even a month from now, because we want to observe and because we want to try to minimize any kind of conflict. Because this is the second point, and it's very important. Every single person that walks the door has a different perspective on what this disease is about. Some of them believe in masks, some of them don't. Some of them believe in hand sanitizer, some of them don't. Despite the science, and I'm sure your brother can do a great job talking about, you know, what's true and what's not. The fact is, we're so polarized as a nation right now that the science almost doesn't matter. You have to make sure that everybody is comfortable regardless of how they feel about it. And that's been one of the biggest challenges that we've dealt with is just that everybody's coming at this not from the science, but from a very different personal perspective. And you have to figure out something that makes the guys who think this is no big deal comfortable, and the people that think that this is very risky comfortable. And of course, your staff as well.
Mm-hmm. Yeah, that's a challenge for you. Craig, you haven't quite opened yet, but I've got a question for you, and it was brought up yesterday in a call I was on. With regard to masks, is that something you're going to require guests or staff members to have on as you open?
Yeah, it's something the governor's mandated for us that our staff has to wear masks, anybody that's working inside of a facility. And then we'll have some signage as customers walk in, explaining numerous things in regards to COVID and what their expectations are, but they will not be required. But the verbiage we'll be using is they're strongly encouraged to. So we're going to kind of let people choose whether they want to wear a mask or not, or our guests at least.
Kevin, do you have any thoughts on that? Is that something you guys are requiring, or is that state by state?
Well, our team members are all masked and gloved. And, because we are sort of nearly equally balanced between food and beverage and amusements, we have to follow all the guidelines relating to both industries. And so, from a staff standpoint, we're very consistent. From a guest standpoint, we are following whatever the local requirements are as far as an actual requirement to do certain things. But we are also, particularly in this early stage, going a bit above and beyond, providing masks and gloves and other things, that, again, we're looking to see how people respond to it, whether it's necessary, and kind of what the overall perception is of doing that.
Thanks, Kevin. Dr. John, masks. Are they effective? Is it really, is it worth all of the bother, or is it something we don't need to be concerned about?
The evidence is there, guys. Masks help, okay? And they help you from spreading the virus if you're infected, and that's critical. It prevents those droplet nuclei from getting, to great distances outside of your personal zone there. And at the same time, they prevent you from touching, your mucous membranes and infecting yourself. Okay. There's studies that have been done showing people, sitting in one area for any one period of time, and they touch their face around 40 to 50 times. And I'll even see people during this Zoom meeting doing it. I do it as well. We do it subconsciously, or we do it to scratch something or get something out of our teeth or something like that. So the evidence definitively demonstrates that masks help. Once again, they knew this in 1918 during the Spanish flu. We know that now definitively. Yeah. And we've done a lot more experimentation to actually show the effectiveness of preventing aerosols from leaving our mouth and our nose by wearing masks. So the science is 100% solid for wearing masks.
Thank you, John. Mike, let me ask you a question. With regard to sanitization of the machines and surfaces, touch points, and so forth, how much of an empowerment are you giving to the guests? In other words, are there cleaning supplies or sanitization stations within the facilities that you're creating, or are you leaving that up to the staff entirely? How much? If I go into a health club, or when I used to go to a health club, they're closed now. There would be a place you could grab a wipe, and before you start on the machine, you wipe it down, and then when you finish it up, you wipe it down. And if you didn't, you got the stare, right? So, what's happening within your space with regard to empowering the guests to do something similar to what happens in a health club?
So there's really two answers to that. I guess one of them is that currently we're doing what's available. So products like sanitization wipes in large quantities aren't necessarily readily available.
Yeah.
So what we would do in a perfect world and what we do today are slightly modified. In our case, what we've done was we've set up sanitizer stations everywhere. We did go out of our way to find a medical grade foaming sanitizer because the gel sanitizers people were all refilling their personal bottles with. And I think it actually creates a concern just like a water bottle being filled up at a water fountain, that you can actually probably create a bacteria touch point from where they're putting their bottle. So we did find a foaming sanitizer that no one can put back into their gel, or when they try it, they realize it and then they stop taking the sanitizer. Our team members are cleaning the game floor regularly. We've opened at a very minimal capacity. So we opened at a 25% capacity of our restaurant seating only. So if we took our largest center at a 1,600 person capacity and said 25% would be 400 people, we've opened at 25% of our restaurant seating capacity only. So we're letting 48 people per hour enter, and we're allowing a 4-hour window. So 1.5 hours of food service and 2.5 hours on the game floor. So it's really limiting so greatly what's going on in the building that our team members can almost follow people around and just continue cleaning touch points. The hardest place to get the consistency out of team members is going to be on interactive games that have loose components. So a down the clown that you really wanted to sanitize all the balls, not necessarily where they're touching the game. Joysticks and gun controls, those are the easy ones. When you get a ring toss and you want them to clean the rings, and you get a down the clown or a skee ball and so on and so forth. So our team members are currently doing all of the cleaning. They're wearing gloves, they're wearing masks the entire time. And that seems to have worked out well. Obviously, as we ramp up and we see guests return to some level of normalcy, I'm not sure how that'll play out. But again, supplies may change drastically, right? You might be able to access self-service supplies a little bit easier.
Right, got it. Todd, a question from the audience, because you've actually had some locations open. For those that have opened, what are guests saying about your health and safety messaging, online or in venue, versus any attendance driving offers? And where should operators focus their initial efforts?
Well, for the most part, we started a safety campaign way before we opened on social media, letting people know what we were going to do. And we've continued to, for our guests that are coming in now that we've opened for a little bit longer, and we're seeing a different type of guests come in, not the initial rebel rousers that we want to get out, we're bored, right? The virus doesn't know you're bored. It's just a virus, but they're out. And so, we've gone over what they see in their communities as well. I think one to the FEC's benefit is that most FECs are doing the right job. Other places are not. They go to restaurants where they're supposed to have 25% capacity. The things are packed, they're booked. So I think we're getting a lot of actually good press for what we're doing in our buildings. And people are extremely excited that when they walk in now that we are safe. I think we talked about masks a while ago. We initially set up to have masks for everybody, trying to find them all over across the country, right? You couldn't find them. And
yeah.
But the reality is people that are wearing a mask, they're bringing their own. So if you're coming to the building expecting to get a mask, you're just coming to take a mask, right? So I think that having masks available for the guests, unless you're required to by your local community, I don't think it's worth the investment of trying to find that and keep it in stock. For your employees, great. But people that are wearing a mask, they're bringing their own mask. They're coming prepared to the building. So I wouldn't spend a lot of time on the mask.
Todd, I'll touch on that for a second. We have the concern where we've got 6 different markets. We did open all of our stores as of this past Saturday. The 6th got open, and the markets are vastly different. And our furthest one is 240 miles from the next one. So the concern we had is that in some markets, people simply don't want to wear masks, don't do gloves, don't want to do anything. And then in other markets, everybody's over concerned. And what we found was that we mandated, even though the state didn't, that if you're on our game floor, once you're done with your dining experience, then you're wearing a mask. And we just feel that it's common courtesy to the next guest, not so much for your own safety. And the pushback in one particular market was pretty hard because people didn't have masks. So we actually found plenty of supply now on disposable masks, and we're selling them for $1. We're not making any money on them, and we've sold hundreds. And completely satisfied the guests. We've had parents and other people say that's a great thing and we love it. And for the people that are complaining about the $1, I think I actually saw in a manager note that a party of 10 refused to buy the mask, so they left. And okay, well then they're probably not really our client in any case, or they'd have bought one-time card and played DDR for 8 hours straight and we made no money. So in every event, the ability to supply it now is coming a little bit more online. And offering it for sale at a zero profit or very low profit has proven to be a really great solution.
Well, with regard to that, Mike, you've got some markets where you say that you actually do have requirements for masks for the guests, correct? The community, the government has said they must be wearing masks indoors.
Only in Miami-Dade County is the only one that says they must, but we're mandating it everywhere.
Okay, so with regard to that, I heard yesterday that that's a real challenge for staff to enforce. They can get confrontational with the guest, and that's a problem that, you know, brings them off of what they're supposed to be doing into what could be an escalating situation.
Mm-hmm.
There's a chain of home service company, or home stores, you know, where you go to get your supplies for tools and what have you, called Menards in Illinois, Wisconsin, throughout the Midwest. And they've actually put they require masks in the store. They've put a security officer at the front to make sure that you have a mask when you come in. And if you don't, they'll direct you over to the service counter where you can purchase a mask for $1. Are you empowering your staff, or are you bringing in, you know, outside security to enforce that?
So we've had one situation on that, and it particularly in Fort Myers is the market where people didn't have masks and they weren't ready to wear them in any form. Where once we've started selling them, people have been grateful, and we haven't had a lot of pushback. On our third night open, we had a guest that, after having purchased a mask, had been told by 3 different team members that they need to wear their mask to continue playing. The manager approached them, and the guest did want to get confrontational, and we gave them a personal invitation to never return. And it was very simple. It's, listen, we're enforcing this because we feel it's in the best interest of our team members and our guests. And if you're not going to do so, we're just going to call the police, and we're going to trespass you from the venue. He left flipping off our manager, and the next morning he was back in, apologized to our GM, and spent the day playing with his mask on.
Huh. Okay. All right. He had to get a little venting off, right?
Yeah. Whatever it takes.
Dr. John, last week the CDC put out information saying C19 transmission predominantly occurs person to person via droplets, and to a much lesser extent from surface to persons. And I actually heard a doctor on a morning television show say that 96% of the transmission occurs person to person and only 4% from surfaces. If this is accurate, should our industry pivot from our hyper focus on sanitizing surfaces to physical distancing measures?
Well, honestly, my feeling, okay, first of all, just because a test identifies COVID on a surface doesn't necessarily mean it's infectious, okay? And because you can detect its genome, but maybe the virus is dead. It's no longer infective. So there's a lot of conflicting evidence about this. So, you know, does it spread via an aerosol like measles? Okay, meaning you cough it out, you sneeze it out, you know, or is it droplet like the flu, which is somewhat different, but they're both kind of the same. You know, is it spread via, you know, human waste? We now know it might be spread by the gastrointestinal system. You know, can our cats give it to us? So there's a lot of conflicting evidence out there about whether or not this thing not lives, but is still viable and infectious while it's on surface. And so there needs to be more research in this area. But my personal feeling for high touch points, especially in your incredible industry, is the fact that like in a medical situation, if you've got people constantly touching one area, that area needs to be disinfected, because you know, it's not like you're touching something just once, but rather you're repeatedly touching it. And when they go into a hospital room and they disinfect it, you know, they hit all the bed rails, they hit underneath the bed rails, you know, they hit the floors, they hit the corners, they hit everything to remove the potential infectious agent that was on the patient before in that room from being able to spread. So my personal opinion is disinfecting surfaces in your industry that are high touch points is critical in terms of making sure your customers and your staff are as safe as possible.
Got it. So Kevin, let me ask you a question with regard to, well, Kevin Williams actually came up with a question. Are there specific machines that you're considering, that you're not considering operating at this phase? So whether there are obviously there's situations in states who have outlawed amusement games, and we're fighting that as an industry. But are there any machines that you're allowed to operate, you're just not going to turn on right now because they're too much of a headache to maintain that sanitization protocol?
In general, the answer is no. We are endeavoring to provide as much as we can. There are 2 exceptions that we're doing right now, and it's very short term. One is that games that require an attendant, simply from a labor standpoint, we can't afford to have people dedicated to a particular machine. So we have made the decision for the very short term, and it doesn't have to do with, with hygiene, it has to do with economics,
Right.
that we're not going to do that now, but we're hoping to, to turn that around very shortly. And the second thing that we're doing is that we're trying to determine how we want to go about spatial distancing in the midterm. So for now, there are certain games that we have disabled. There's a message that we have on the card swipe readers that says that this machine is closed for social distancing. And again, that's primarily for, for staff preservation, so that we don't have somebody, that you've got a bank of 5 big bass wheels and somebody wants to come right up next to another party. And, you would hope that they would use common sense, but they're not. Now there's conflict. We don't want to have to be the arbiter of that. So in the very short term, we're doing that. We are looking at plexiglass barriers. We are looking at, signage. We are looking at other things, and we're evaluating in a couple of stores what happens when we don't do that, but we provide signage. We're evaluating a number of different things to try to determine really how the guests act, more so than the science, which we understand, right? We understand how to keep things clean. We understand how to protect people. What we don't understand is how to get people to behave in a certain way.
Got it. Craig, you're getting ready to open. How are you addressing staff training? What's going to be new for them as you go into the reopening phase?
Well, we've kind of gone through 2 different journeys with our facility. We're going through the guest journey and the employee journey, and we're having our whole leadership team do that. From coming in, all of our staff is going to be temp checked. Actually, because we have a water park as well, the majority of the water park industry is temp checking all of their guests. So we will be temp checking our guests as well. But again, masks will not be required. There's a lot of different little training things that we've done. We've done some COVID certifications. There's different associations that have different things, so we can at least get our staff trained on COVID. We've done a video on proper mask wearing, because a lot of the facilities I'm hearing across the country are having issues with their staff not wearing the mask properly. A lot of people just wear them here. It needs to be covering your mouth and your nose. And I know that's going to be a struggle. As some of you guys have said, you're going to have what we call the Karens of the world, or the social mafia, so to speak. It will want to chastise you on social channels. So we're going to have to be addressing that. So we're trying to get our staff trained so they understand how to wear masks, how to use disposable gloves, when they need to swap them out. I believe that gloves can also create a false sense of security for people, and that's a concern of ours. Like most of you within the food and beverage industry, all of ours were wearing gloves before, so that's easy. It's our sanitization team that's going to be a little bit more challenging. So as we get ramped up here, we're going through 3 different processes, which is bringing in all of our management team, make sure they understand every single thing, with 9 different attractions that have their own unique challenges. We're going to go through all of those, and then we're going to go through, train our supervisors, and then bring in our staff throughout the weekend. So we should be open on Monday. We just got word of it 9 p.m. Tuesday that we could open.
Yay.
Yay.
Are you doing role playing with the staff? Are you,
absolutely.
Scenarios?
Yeah, we're actually going to walk through every single attraction later today. The management team, the supervisors, staff, we are going to switch roles. We're going to go through the whole process of running from laser tag to bowling to the arcade, and the different sanitization methods we're going to be using for everything, and mini golf. And there's just a lot of different things for each one.
Yeah, great. Todd, you're in a state where the governor has made an edict that amusement games, arcades are not allowed to open. How are you involved relatively to lobbying? What efforts are you making to challenge that?
Well, we've been in contact with the strike force, which is with the governor's office, and we've gone through a lot with the bowling associations as well, and in the theater associations as well, because a lot of theaters have amusement games, to continue to push for what we can open. But it's fractured here in Texas as well. There are local governments that are overriding what the governor is saying. I just heard that Arlington is going to allow laser tag to happen, which is technically not supposed to happen, but I think they're opening some laser tag this weekend in Arlington. And so it becomes a contentious battle. There have been some places in some communities where the community has called and complained against places open and shut them down, like escape rooms and those kind of things have been called on. So the biggest challenge we face is the lack of information or misinformation almost, and really how much it changes every day. And just like I said earlier, not an understanding of what we do in the business. So we're lobbying continually with the governor. I think our next update is June 1st that we may hear in Texas. The governor actually spoke in Amarillo yesterday. Amarillo was a hotspot. We have a location in Amarillo. And we were allowed to, Amarillo was pushed a week behind everybody else, but yesterday he announced that we can go up to the 25% in the bowling, 50% in the restaurant, 25% at the bar. But what we're hearing is, though, the games may not happen in this next phase. And my understanding of phase 3 is that phase 3 lasts until phase 4, and phase 4 is supposed to be a vaccine. So it doesn't make sense. They can't say games will never happen until there's a vaccine. There'll be I don't know what we'll do.
Yeah. Mike, there's a question from Brian Smith. He asks, how often are you going to sanitize games? After every play, every hour? I mean, what's that repetition look like within your spaces?
So the rotation right now is really based on activity, and our activity's been less than stellar, but it's been good for reactivating our businesses. So currently they're sanitizing more than the usage is, and it's kind of counterintuitive that we're limiting people in our buildings. So we're saying, no, don't come in and give us money, but we're spending more money and more labor than you typically would. So it's a tough balancing act. We don't have a set schedule that says every 15 minutes this machine gets done. So in one of the few attractions we don't run any attended attractions. What we do at bowling in one center, but one of the unattended attractions we run that's a higher touch point is a mini ride or two. And we think it's a great attraction and it always fits well, but it's an enclosed capsule. It requires them to open and close doors to get in. It requires them to select the game. And that game is being sanitized between every single use. And so some areas are getting a little bit more attention than others. But in particular, it's not set by game or by area. But we certainly are running our game floor that would normally be staffed on a slow day with one person roaming with 3 or 4. And certainly that, like I said, it's counterintuitive from a labor cost perspective, but it makes good sense. I'm going to cover just a few things that have been covered that I'd like other people have talked about. Please. I just want to jump in if you don't mind.
No.
Craig, one of the things for you to consider on training that was early on, somebody in our office here had realized it and took the initiative to do it, but mask training for your team members and communication skills, they're really just not common sense. So the inability for someone to read someone's lips, it's much harder to understand what I'm saying right now. They've got to speak much more pronounced. They've got to speak up in a loud environment. They've got to over-exaggerate their facial expressions if they're trying to show some enthusiasm or equal the guest's enthusiasm to some degree. We put together a pretty good PowerPoint that covers a whole bunch of it and shows some points, and then we've used it for training. Pete, I'm happy to sanitize our logo off that and send it to you, and you're welcome to distribute it. Maybe it'll help some people. But we expected that to be about 4 hours of training in each center, and it ended up being 2 days worth of training, including role play, to get people comfortable with it. So I would say that that's a real point to talk about. One of the other unexpected consequences, if you will, and feel free if anybody has some suggestions here, but guests are always going to push their limits. My understanding is the CDC doesn't recommend or says that someone that has asthma shouldn't wear a mask or doesn't have to. So of course we had a guest that came up and said, well, I have asthma, so I can't wear a mask. And ironically, I happened to be in the center and the manager came up and said, what do I do? And I said, well, we're going to get a ton of those. All I can tell you is if somebody says the CDC says something, pick up your phone and look at it, right? So the first off. And I was happy to go walk up to the guest and I asked the guest to see their asthma pump, the little inhaler or whatever it's called. And they said, well, I don't really have asthma, but I don't want to wear a mask. And I, again, invited them to go visit another center. So that, you know, you're going to get a lot of weird questions. You're going to get a lot of things that we don't know how to answer. In a normal environment, we would all be worried about ADA compliance and did we discriminate to somebody, or did we do any of that? I'm certainly not going to give a legal opinion on this presentation, but I will tell you that if you're continuing to do the right thing in the public's best interest, I think there's going to be a lot of leeway right now. Certainly an attorney will still enjoy the time of wasting our money.
Right.
If they found something, but I believe that the defense that it's COVID and you did what's in the public's best interest is going to be pretty easy to cover. And then Todd, I just had a quick question for you. You said you opened your theaters. What are you showing for content? I don't understand there to be a lot of content available right now.
Yeah, so the content that we put on was what the movies that were out when we shut down.
Okay.
So those were still available. And then we've rolled in some throwback movies. And we're actually fixing to run a promo of free movies. We're going to have movies for free. We're going to show old stuff and, try to make it up on F&B and just bring people in until the studios release. We think that's July that new movies are coming out. But until California and New York are ready to go, the studios are going to hold on to those movies as long as they can because they know that they're going to lose that.
Right, they're big markets, sure.
Right.
Mike, I'm sure you found as we have that social media is really amplifying some of the things you talked about. I mean, we've seen people who are sharing with each other that, hey, if you don't want to wear a mask, tell people that the ADA says that you don't have to if you have a breathing disorder, which of course the ADA doesn't say, but frontline staff member, team member isn't going to know those nuances.
Sure, it's very intimidating when they get called out for anything like that because they feel like they don't know if they're making the right decision. Yeah, social media is certainly a weapon of choice at this point, and I can tell you that we're not making everybody happy. We've had some peers in our markets that we've gotten calls and said, "Oh, it's a free for all in their building, and you're requiring masks, so we're coming to you," or whatever those have been. I would warn as a whole industry wide, let's make sure not to Monday morning quarterback anybody's game. I think we're all fighting the same battle and we all have good intentions. Getting our frontline team members to live up to all of those, not get complacent is a battle that we're all fighting.
Yeah.
I would tell you that everybody, if you haven't made good connections with all of your local competitors and peers in your market, this is really the time to do so. And if you hear something that may go viral online about their center, pick up the phone and tell them, say, listen, we're not calling anybody out. We're, again, being good stewards to the industry. And as an industry, we have a far bigger target on our back from 5 people than we do the 5 million that enjoy us. But one center was getting beat up online of one of our competitors, and I went and looked for it. I guess they were able to turn off their comments or whatever it is online. But before they did so, they had one guest file a complaint or say something negative. And before you knew it, there was 30 and 40 people that had reposted it and said things. And I went through, and of the 30 people that had reposted or had something negative to say, all 30 people were in the UK. So one person that's here from the UK that has friends went and posted something, and all of a sudden it's as if it's gone viral with local guests. So just be real conscious of that. Social media, certainly, Kevin, as you said, has a real way to amplify those things. And that asthma guest, I get, maybe I hadn't seen that online, but I haven't spent as much time online roaming, if you will, these days. So I don't know what's out there.
I would agree with Mike, is that, every local community has their own unique nuances that you have to do. You have to kind of, your community better than anybody, and you need to do what's right, what you think is what's right for your business. To me, it's about building some long-term customers again, or getting those long-term customers back. You get one shot at reopening. This is a very unique situation, and you need to do it right. When the guests come in or when your staff comes in, you can't be fumbling around. You have to be confident. You have to know what you're doing. You can't say, oh, we haven't done this. We've never done this before. You are instantly going to lose the confidence of the parents or the guest that's coming into play. And that could really cost you down the road.
Yeah, totally.
Yeah, I don't remember who it was. It was early on talking about the extremes of guests. I think it was you, Kevin, that said some guests just simply aren't concerned at all, and those are the early adopters to return, and some others. We did find that there's that extreme of guests. We had one guest that had booked our birthday party, and we very early on made it known to all of our guests that had booked events while we were either closed or still anticipated to be closed, that they were going to be offered a refund on their deposit. They can reschedule. They can really do whatever they want. There wasn't a lot of leeway there. We have one guest that every single week has now called and said she doesn't want her $50 deposit back, even though we said, let's just give it to you and you'll book it when you want it, because she just wants to have her kid's birthday party with us, which I can completely appreciate. But she's begging us to allow a party of 25 people. And my answer, as of yesterday, when they called back and said, well, now what can we do? I said, she can have a party of 25 people. She's going to have 6 different tables. They're going to be separated in the restaurant as any other guests would be. They're not getting a private party room. They're going to be served as regular guests. They're going to have to come in staggered because that's how we're allowing guests to enter. And when they go to the game floor, they're going to wear masks. They're going to not congregate in more than 6 people, all of those things. So you're going to get every piece of that. I don't know that she's confirmed yet that she's coming in, but I kind of also made them aware. I said that if you're inviting 25 people, I don't know that 25 people are going to show up, right? So you're going to have every piece of that person. It's more like a real room of a conference of economists, right? So 100 economists in a room and you have 100 varying opinions. So you're just not going to get 25 people to show up from 25 invitations is what my belief is.
Yeah.
The good news is, and feel free to correct me if you've seen something different, any of you guys on the panel, but honestly, we've had very, very few complaints, either in person or online. The only complaints that we've had, frankly, are people who we're running a limited menu in our dining rooms. And so there are people that are like, oh, but I love this dish or I love that dish and it's not available. Because for the most part, as we said before a few times here, the people that are coming first are the diehard fans, the people that really, love what you do and, have missed you and want to come back. And so there's going to be a few bad apples in the bunch, I'm sure. And I keep waiting for some sort of backlash, but for the most part, these are people who are, we found, very, very appreciative of the fact that we are opening, appreciative of the extent that we're going to keep things very clean and safe and distanced, and so there are issues. My concern about social media is twofold. One, slightly concern about people saying things online that aren't true, but also what social media is priming these people for before they come in. That was the point I was trying to make, is that we have guests that come in that have been primed by social media that, well, if you don't want to wear a mask, just say that, it's an ADA issue and they can't ask you any questions about it. Or, all kinds of different things that have filled their heads, because not everybody gets the same news from the same places that you get your news from. And so it's important, again, to really, when you have those interactions with guests, try to understand where they're coming from and have a plan for how you are going to get them to see your perspective, because we don't all have the same perspective right now.
Yeah. So, Kevin, I want to stick with you for a moment. Rubber hits the road in this business. We are certainly a for-profit enterprise. How are the numbers in the early indicators? How's it looking?
On the advice of counsel, as a public company, I can neither confirm nor deny anything.
Fair. Anyone else can share?
Listen, I think it's an obvious thing to say that the numbers aren't what they were once, and beyond that, I really can't say.
Fair enough. Anyone else have anything to
volunteer our
contribute to that
information?
question?
I was actually going to ask Kevin if he's able to share some of it. So there's the answer for what he can share. And completely can appreciate that, Kevin, and understand your position. I'll tell you, we opened 5 of our stores on a Friday, 2 Fridays ago. And the first weekend we performed at 4.5% year over year for same store sales. Our payroll wasn't 4.5%. If anybody's wondering, somehow we've managed to blow payroll numbers out of the water with 4.5% production. We opened up our Miami store this past Saturday, and we had the same 4.8% for the first weekend for year over year same store sales. The second weekend, while Miami was just opening, the other stores were rolling into their second weekend, and we had a great response in that we were now 20% year over year. So we grew 4 times in the first week. And we're not in a position to spend a lot of money marketing, so we can't go out and scream to the world, hey, we're open and come in, and nor do we want to, right? So we still have to be careful that we want to make sure that we're being overcautious. We're not overfilling our building. There's no lines at our doors if we're limiting entry, so on and so forth. So that's been a great response, and that people that have come back already. They felt comfortable. They that consumer behavior I talked about early on. So my hope is that we continue to grow, clearly not at a 400% for the next 10 weeks, which would be nice, but we continue to grow at a pace.
Here.
Say that again?
Come on, set some expectations here.
There you go. I do believe that this coming weekend we'll do more than double what we had done. So I believe we'll grow that more than 20%. I hope to get to a 50% year over year comparable. And we see some positive things that say that. So I expect that the curve will continue to grow. until we get to some barriers of what we're limiting in the building. I do think there's pent up demand, and I do think there's one other positive is that we're running our opening very different than we've seen anybody else do, and really being over conservative. So the only way you can come visit one of our centers is by making a reservation for a table in our restaurant, and we're running at a very reduced capacity. When you're done enjoying your meal, you can come on over and enjoy the game floor, but we're a restaurant that happens to have games. We're not a FEC that's open just to come in and play games. So with that, we're allowing walk-up reservations, but if they come up and there's no reservation available, we're turning them away. There's no line at the door. They can go wait in their car, and if there's a spot coming up, we'll be happy to give it to them. We're not trying to turn them away. But what I see happening, and I'm hopeful happens, is as we build up some of our peak hours and we actually do fill those slots, which we haven't done yet, is that we'll have somebody that really wanted a 1 o'clock slot that will take a 3:20 slot, and we spread out our day. So we, at 25% capacity, quite frankly, if we could all run our centers at 25% 7 days a week while we're open, we're doing 400% of our business anyways. So I don't know that the capacity limitations concern me as much as filling at least to those limitations in hours that we would otherwise be at our peaks. And I think there's the great opportunity to spread it out, as well as that kids are not in school. Some parents are working, some aren't, some are working from home. So their ability to take a 3 o'clock slot is much greater than it would normally be.
Got it.
I was intrigued to see on the survey that came up just now that the plurality of respondents said that they were down 50%, which, seems like in one ways, not great, but in another way, probably better than I would have expected. And so, one of the things that occurred to me a while ago is that to the extent that you're able to afford it, we've seen a tremendous amount of consumer sentiment data that says that, no matter what happens, I'm going to wait for some period of time to see how things shake out before I go out of my home. And so making an investment in opening, to the extent that you feel comfortable doing that, and to the extent that you feel that you can afford to do that, I think makes sense in one way, which is that, if you think that, the optimal time to reopen is going to be August, that you're going to have a lot of people that are out there, if you start in August, you may find that your customers are returning in November, whereas if you start in June, then they may actually come back in August. So to the extent that you can, you can align your operations around what you think is likely to be the scenario that you're going to see, to the extent that you feel comfortable reopening, to the extent that you can handle that, I think that, it is advisable to do so simply because the more time that you have when you start the clock, the earlier people are going to feel comfortable coming back. And if you do the right things, then they should be comfortable coming back. You should be creating a nice, safe environment for them to operating in, for them to operate in, for your staff to operate in. But if you wait until August, then you may find a lag in your community before people realize that everybody has gone through the experience okay, and they feel comfortable turning as well.
And you may still find yourself in the same situation where economically you can't go out and spend grand opening type money to reactivate your centers. So allowing that time to build back up, and I think that 400% increase over 1 week really is that those guests told other guests that we're open, right? Because we don't have a radio campaign, we're not wrapping any buses, we're not putting up billboards, all of those things that we'd like to be doing all the time, we're not doing. Kevin, one other thing just to think about, and obviously you guys have the same challenges with having the sports bar environment, is that there's one huge segment of our business that's missing, is that there's no content, right? I've got my largest center has 170 TVs on it, and I'm showing reruns. So if anybody's got the Honeymooners on DVD, let's all watch it on 170 TVs, but not a lot of content out there. So not having the sports, I think, is going to have a great impact on the dwell time within our F&B category, right? Because there isn't something on for them to watch. So I'm sure Dave & Buster's is going to have a larger challenge with that than I do, in that we're about 38% food and beverage. They're 50%, I think you said, Kevin. So they're more dependent on that dwell time within their bar area, I would think, and their sports category than we are.
That's a really good point. Hey, Todd, with regard to redemption, have you guys opened redemption centers, and how are you managing that?
So the only location we've opened is in Tulsa. Oklahoma has different guidelines than Texas has. Basically in Oklahoma, you have to have 6 foot distancing and follow CDC sanitation. That's really what Oklahoma has said. So We've taken in redemption in a different area that we're going to make sure that we're safe. So kind of what we're doing right now is, because the level of volume has allowed us to, is we're doing redemption as almost a valet service. So basically redemption is roped off. You can't touch anything, right? You walk in, you're brought into the redemption center. We use a touchless scanner to scan your card. It puts your points up on the TV. You then tell the attendant what you want. The attendant bags it up. There's no returns once you've touched that item, and you're on your way. And we really have seen no negative pushback from that at all. But once again, the volume in the building is allowing us to do that. We could not do that at our regular volume, but we have been able to push some product and get some redemption going.
Todd, your description makes it sound like you do redemption stores. Am I correct in that? So similar to David Buster's?
Yeah, we do stores, correct.
Okay.
Yeah.
So we're I think probably stuck back in another era where we still do counters, and we think it's the right fit for us. The conversation is a whole nother one, stores versus counters, but Dade County has the strictest regulations, and they've required it anywhere that there's a counter touch point for plexiglass barriers to be put up, right? So if you go to a public supermarket or a Menards, they should have a plexiglass panel. So in our case, we have in Miami, which again is the one county that's mandating it, is a 48-foot redemption counter. So a 48-foot piece of plexi, one is costly, but really is a waste, doesn't look good. How do you secure it? All of those other challenges. What we've come up with, just for somebody to think about, is that all of our team members are still wearing masks, and they've gone through that mask training, but anybody at a counter service is wearing a plexiglass face guard. So they're wearing a shield, almost like a welder shield. They're not readily available, but you can certainly find them. They cost anywhere between $1.30 and $3. We're buying the cheaper ones because we want them disposable. So we're assigning them to people, so they're not sharing a mask and putting it on their forehead and so on and so forth, and going back and forth. But that's met the requirement of a plexiglass shield, and they're never engaging a guest while they're not wearing it. So that's been a solution that's applied well, and that may work in several other environments.
Kevin, redemption, how are you guys managing that distribution?
Similar to what you just heard. I mean, we are offering it, and we're kind of a store-based environment. We're obviously doing a tremendous amount to try to protect our staff and to ensure that the area is clean. And I think that, again, it's an evolving situation as we actually see what happens.
Got it.
Yeah, well, our store, how we're going to end up doing it is we're just going to basically let one group, family, whatever it is, in at a time. They can't touch anything. They can pick and choose by pointing, and then we'll bag it using different little grabbers we have or whatever, and then kind of scan their card, do the process, and send them on their way and bring the next one in. And on the outside of the store, we have some things posted that kind of shows all of the prizes ahead of time. There's pictures and how many tickets it is. Just so people have a little bit of an idea, and hopefully it'll expedite that process a little faster.
Got it. Thanks. Hey, Dr. John, question for you. As we go forward and data points start to come out, what's going to be important to us, do you think, for us to know relative to this pathogen? What are things we should be looking for information-wise?
Well, information-wise, paying attention to sites like the CDC, paying attention to research that's coming out on the virus, hopefully that it's explained at a level that the general public can follow. I think that's absolutely critical. We're in a pandemic. This is a worldwide pandemic. It started, I think, in November 2019. The human species, Homo sapiens, has never seen this virus before, and we're seeing the effects of this, at 100,000 dead from this virus. We understand what the comorbidities are. We understand the populations that need to be protected. There was a conversation about asthmatics. I mean, asthmatics, technically, they want to avoid places where you have large populations of people to some degree. And I'm sure their physicians tell them to do that. I'd be surprised if they did not. And then being aware of paying attention, watching out for the hype, especially with the vaccines and whatnot. Be careful with that because obviously the stock market loves it, but I think the general population should probably wait a little while and see what additional information comes out. I mean, we know what to do. We know what public health measures to take. We need to test. We need to trace. we need to isolate, and we need to protect. Those are the 4 things that we need to think about moving forward, especially people in your industry. And it seems to me they're already doing it. It's been wonderful to hear all the great things they're doing. And so, you know, and then also, you know, there are things such as long-term consequences of the virus. What happens to patients after they're infected? Are they immune? I mean, I would argue they might be immune for a couple of months based on what I know about other coronaviruses, but that immunity might wane. And so they might be able to be reinfected. So really, we're in the Wild West with regards to understanding what this virus does. And really, we need to be paying attention to what happens as it changes. You know, something else, you know, when the second wave of what's referred to as the Spanish flu, but it actually began in the United States, when that virus first came, the second wave is where you saw a greater amount of death than during the first wave. So we don't want to let our guards down. You know, great cities like St. Louis and Denver thought they were doing the right thing by reducing restrictions, reducing, you know, common knowledge public health measures. And what happened? They had a higher level of death than in cities that actually continued to apply these social distancing measures. And so, you know, it's just paying attention to what's really obvious as it comes at you. Obviously, any kind of interesting information about therapeutics, I've seen none that made me go, wow, there's just nothing out there so far. And then obviously with vaccines, I've seen hopeful signals there with some of the vaccine data coming out. But until I see those phase 3 clinical trials and then phase 4 clinical trials, and then the reporting measures of potential vaccine negative effects, I won't be really excited. All that being said, you know, HIV suddenly appeared, and now we've got a drug cocktail that allows them to live normal lives. And in fact, once their CD4 bearing T lymphocytes come back up, they can even go on something called a drug holiday and not take those drugs, which can be debilitating to these patients. Okay, so there's a lot of positive things out there. Also, this virus is not like HIV, where the virus can mutate so rapidly in one patient that you really can't pick a vaccine target to cover all patients, but they're trying. And you know, there's been some good evidence to suggest some of those vaccines work better than none whatsoever. But we're still far off from that. This virus, however, based on its molecular biology and based on how it replicates, it doesn't mutate as readily. It actually has something called an RNA-dependent RNA polymerase. Big word, I know, but what it does is it just makes copies of its genome. But this one doesn't make as many mistakes, for instance, as the replicase with HIV, you know, which causes lots of mutants to emerge and then evade the immune system. And so this one, I'm glad that its enzyme, shows high fidelity. And so, you know, meaning that vaccines are more approachable for this particular type of virus. And so, and more importantly, stay positive. And we know what to do. And you guys are all doing it. You guys should be proud of your efforts. I mean, you're trying to reopen society and things that are important for people. And so focus on the positives. I think that's also very important, but be prepared if, you know, suddenly we find we have to step back because there is a possibility that could occur.
Thanks, John. And lastly, as we're wrapping this up, to the panel, I'll just start with Kevin. As you've opened up your facilities, are there attractions your guests are simply avoiding, even though they're allowed to play them? Have you seen a change in customer habit, gameplay habit?
Not really.
Maybe that's a result of that early adopter saying, you know, devil may care, I'm ready to go. Mike, have you seen any changes? Customer behavior?
Yeah, there hasn't been enough volume to really take any data and try to compare it. I think that it would be premature if I just assumed that, or quite frankly, it may be a game that's not working and we think they're not playing it. There's way too little of a sample set so far. I will touch on one thing, and Kevin, if you don't mind answering as well, is we had talked to our managers about coming up with a social distancing plan for the game floor, and we'd given them signs to put on the machines that we're putting out of business or shutting down for the time being. And we had to edit that, and I would warn everybody to pay attention to this because I think common sense doesn't apply, is that if you have a game that has 2 players, your managers want to put 1 player out of service. And that doesn't necessarily apply to a game that has people that would only play against each other. So a flappy tickets, the 2 different guests that are of separate parties are not going to play that game together. Whereas they may play 2 different guests from 2 different parties may play a lane master together because it's really 2 independent games. So Kevin, have you guys mandated from corporate what can go out of service? Or
well, you know, every store has been custom tailored, because when you think about the plan about what games you want to offer and what games you don't, you have to actually look at the specific floor layout, because in some cases there are games that are 6 feet away from everything else around it. So, you know, that's a pretty straightforward situation. You know, the situation you talk about is one that we had to think about, as did we have to think about games that are linked games that are individual freestanding units but are linked together. So for instance, Mario Kart. You know, Mario Kart, you could say, well, we're going to turn off every other station, but that means a family of 4 can no longer play with each other. And so what we believe is happening right now is that, you know, ours has always been a very social industry. What we offer is a social, you know, experience, not so much about the games themselves, but about the experience that people have.
Yep.
And I think that's true more now than ever. But what's happened is that our guests have become more tribal. So there's my group that I came with, and then there's your group that's a potential threat. And so when you think about operating games, you have to think about, you know, okay, Mario Kart, there are 4 of them, they're for 4 people. Now, theoretically, in normal times, you could have 3 people playing and one guy jumps on the end because he just wants to play himself. That's an area that we're still struggling with, again, from trying to avoid any kind of guest friction or a manager call. We're trying to figure out, okay, how do we make sure that we encourage the guests into a behavior that is well considered for everybody else? And those are the ones that I think really require the most thought about how you're going to offer them, because they are, in theory, let's say 4, 5, 6 separate game units, but it's really one game, because the idea is that you're playing against the other people. And so, you know, you have to, I think through all of those scenarios. I think you have to do it individually. If you have multiple locations, you've got to think location by location, what is the layout of the floor and what am I going to do? And again, not so much from a hygiene standpoint as from a, you know, from a guest interaction standpoint.
Yeah, I totally agree. That's why we had originally left the original list to the managers to come up with, and then we quickly found that they were just doing every other station, which didn't apply. I will touch on the games that are linked. Keep in mind, as you all are deactivating games or player stations, that oftentimes you have to leave those games in service and turn off the game card reader or find another way to disable the game. Because if you take down every other driving game, you shut down the network and the game's no longer linked. So if we have 4 cruising blasts and we've turned off 2 and 4, we've left 2 and 4 on, turned off the reader and put a don't play sign on the game, but allowing the network to survive so player 1 and 3 can still play against each other.
And I realize this is a minor consideration, but it just looks bad. I mean, it looks like the games are out of order. So, you know, we use Embed. And so very quickly in this, we reached out to Embed and were able to get a firmware update that displays closed for social distancing or something along those lines. So that it's very, very clear that it's not out of order. You know, again, a minor consideration considering everything else that's going on, but you know, still, you know, from an environment standpoint, from an atmosphere standpoint, you want the guest to understand not only that the game is not out of service because of something that you've done, but also it's being done for their protection. And there is, by the way, a large value to what I would call hygiene theater. You know, the fact that, you know, a lot of people are, you know, taking guest temperatures when they're coming into the stores. You know, I'm sure that Dr. John can confirm that that's not really the most effective way to try to ensure that you have a safe population inside your 4 walls, because people are asymptomatic. But from a, you know, from a theatrical standpoint, from a confidence building standpoint, you know, in addition to things that actually do make a difference, the more that you can do to make sure that people understand that you have their interests in mind without making them feel like this is a dangerous environment with threats around every corner will be valuable, I think.
Agree
Well, all right.
100%.
Well, that's all the time we have for today. Thanks everyone for attending. Thanks to our panel, Craig, Kevin, Todd, Mike, and John. You guys are outstanding. Really appreciate your time and expertise and sharing today. I'd be remiss without also thanking my team at AAMA who puts this all together, Tina Schwartz and Alex Reichsdorf. You guys do a phenomenal job. We'll see you folks next week. We'll be getting out information for what the next panel will be about, the next conversation will be about. And everybody hang in there. We will get through this. Thanks very much for being here. So long.
Thank you, everybody. Bye-bye.
Thank you.
Take care, everyone.